Bloating, constipation, fatigue, and breakouts. Most people think that these are just regular, willy-nilly issues that you go on through life. Maybe age has brought them on, stress has brought them on. And while all of those things can be true, all of these things are also connected to one thing, and that's your gut. Hey y'all, my name is Brianna. I am a gastroenterology nurse practitioner. This is what I do on a daily basis. And today I'm going to be breaking down 5 signs that your gut health is off and what you can do about it. I typically host a Gut Health Friday segment on TikTok and Instagram. So if you're interested in very short videos about a certain topic where I outline symptoms, signs, and also treatment options, not as your doctor, just as what I know, check me out on Instagram and TikTok as well. So every day when I am seeing patients, I see at least 1 to 3 people with issues with bloating. People come in and might think, oh, I'm just bloated all the time. I might have IBS. I don't know what this is, self-diagnosing themselves. What not really thinking about what other things can be causing it. One of the first assessment questions that I always ask my patients are, what is your diet like? A lot of people just don't understand how much diet plays such a huge part in any kind of disruption of the gut. Also, just because the things that we eat now are very high in whatever it is they're putting in foods, hormones, just whatever. I just kind of feel like the produce that we put in our body is not as great as it used to be. I don't even know how great it is or it was. We just eat what we eat because we have to live. We have a lot of foods that are here in the US that also are banned in other countries. And so a lot of these things have certain stuff that disrupts your gut flora, can disrupt just your body, hormone regulation, and all of those things, and can cause constipation, bloating, acne, breakouts, and things like that. So let's start with bloating. Bloating is a common symptom that I see most often. And if you're bloated every now and again, maybe you're on your cycle. I know for women, sometimes just because of the hormones, you could be bloated more at a certain time of the day. If you're on your menstrual cycle, you can be bloated. If you had a big meal and haven't quite digested it, you can be bloated. So these are very normal occurrences. But chronic bloating, I feel like people usually just brush it off like I'm bloated. But I've heard a lot of people that I've had come in contact with or have seen as a provider say, oh, I'm so bloated, I look 5 months pregnant, or my stomach is just always distended and tight. And these are the things that I signal a red flag in my head to say something else may be going on. So a couple of things I typically focus on when I'm doing my assessment for chronic bloating is 3 things. 1, sometimes the digestive system can slow down or is slower than it should be, which causes bloating, leaving food in the stomach a little bit longer, and you feel like, oh, it's been hours since I ate. Why is my stomach still bloated? Why can't I zip up my pants? Why can't I just sit and feel comfortable because my stomach is so big and tight? The second thing is an imbalance of the gut flora or the gut bacteria. I will shout to the rooftops to anybody who will listen about probiotics or things that will naturally balance the gut. We have good bacteria and bad bacteria, and sometimes bad bacteria might overtake the good bacteria. And so that will cause sometimes smelly gas. You might have a lot of burping or belching, and bloating is one of those things. Also, if you're constipated, etc., these can all go hand in hand. But I do recommend doing a probiotic literally every day. It can be in food form, like kimchi or fermented foods. It can be like yogurt. Kefir is something that I swear by for myself and for women. I also take capsule probiotics, but whatever probiotics makes you happy and whatever you can afford, because I know probiotics can get a little expensive, but I will shout out to the rooftops to take a probiotic every day. The third thing that I always look into is just reactions to certain foods. Celiac disease is a big thing, which is intolerance of gluten. One of the biggest signs and symptoms of that is bloating. Other symptoms or other foods, you might have food allergies that you developed and you don't even know it. One of the things that we target is lactose intolerance, whether that's a sensitivity to dairy or just having an allergy altogether. A lot of people don't know that they have an allergy or that they're intolerant to certain things. We usually tell patients to maybe do a food journal so that while you're eating, you be more observant about foods that might make you more bloated than others. And then take those foods that you have been able to single out and say, hey, let me get tested, allergy tested, or let me try to do an elimination diet to see if that cures up anything. Because if it does, then it's probably that certain food that might be causing the chronic bloating. So for bloating, what signs, what symptoms are we looking at? So if you have ate or maybe even didn't eat and you have tightness in your abdomen, that's something that we typically look at. We also look at feeling full quickly. We call it early satiety, right? So you might be eating a meal and maybe you didn't even eat what you typically do, but you had a few bites and you're already feeling full. That is another symptom that we typically look at. If you are visibly swelling in the abdominal area, again, another sign and symptom that we look at. And then, of course, discomfort after eating. I ate my meal. Don't feel good. I really feel sick on my stomach, or my stomach just feels really tight for a while, etc. What can we do about those symptoms? So first thing is slow down while you're eating. I feel like a lot of people eat really fast or don't know that they don't chew very well. So we typically try to tell patients to slow down while you're eating. You don't have to scarf it down or anything like that. Chew really well, especially things like meats, so like red meat or things that might require a little bit more mechanics chewing wise. Also, when you don't chew really well and you eat really fast, you swallow a lot of air. So for the air portion of that, you might again be bloated, but you might also have a lot of gas that you might need to get out. So that's why we tell you to slow down, chew very thoroughly, etc. Second, again, you want to start paying attention to your foods and observing what you're eating. I talked about this a little bit earlier, but we typically have patients to do an elimination diet just to observe things that may be giving them GI upset or bloating, etc. So that, hey, I ate this, I feel worse after this, maybe I should take this out of my diet. This is high in sugar, I didn't really like the way it made me feel, maybe I should take this out of my diet. And then third, of course, if this is happening consistently, you don't want to normalize anything. You just want to stay ahead of the game because your gut health affects a lot of systems in the body. And so you just want to stay on top of this and make sure you're living a very balanced, healthy life. Probiotics, lots of high fiber foods, fruits and vegetables, all of those kinds of things are always all of the things that I typically tell my patients to do, and most of them feel better afterwards. Next up, let's talk about constipation or irregular bowel movements. You would be surprised how many people that I talk to, that I see, that I say, oh, are you constipated? And they say, no, I'm not. And I say, well, how many times are you going to the bathroom in a week? So a 7-day span. Oh, about 2 to 3. And I'm like, wait a minute, 2 to 3 times? Possibly? That is not normal. Now, a lot of people do not have bowel movements every day, but if we can get you to every other day, that's great. Some people are very regular, going to the bathroom 1 to 2 times a day. That's not bad at all. It's just about your body and the way that it digests. But a lot of people normalize constipation. It's just like, oh, I've been dealing with this for my whole life. I only go 1 or 2 a week. I think that's normal for me. And it isn't. And then you come into being constipated very severely, and then you have abdominal pain, you have bloating, you have a buildup of gas, and it just becomes a cycle. So it's just like I'll use all of these things, I'll go to the bathroom, and then the stool kind of builds back up, and then we're right back at square one. So let's talk about what the signs of constipation is, or what constipation really is, and then also what we can do to combat that so that we can, 1, decrease the bloating, 2, treat this constipation. So a lot of people think that if I'm going or I'm regular, there's no way I could be constipated. But it's about how you go to the bathroom too. So I always ask patients to describe their stool. What are you seeing? Are you seeing small little pellets that you're trying to get out? Are you seeing thinner stools? Are you straining? Are you sitting on the toilet for a very long time? So a lot of times constipation is classified by a number of things. One is the absence of bowel movements. The other is if you have to strain. The next is if you are sitting on the toilet for long periods of time because you are waiting for it to come down. You typically should have a sensation that you have to go and then be able to go maybe a couple minutes or immediately after. If you don't feel like you're emptying all the way, so we call this incomplete evacuation, which pretty much means I have a lot of patients who say, oh, I went to the bathroom, but I feel like I just didn't get it all out. So that is what that signifies. Or again, you're going days without a bowel movement. This is a sign of constipation, but also your gut is not functioning at its very peak optimalism, and we need to fix that. Constipation is another thing that really can expand to your other body systems. So along with creating bloating and gas, you can also have discomfort in the stomach. And then you can also have fatigue. You're not really getting out the toxins of your body through the bowel the way that you're supposed to. We do also have other organs that works to eliminate toxins, but again, you have to get them out through your bowel, right? And so there are a lot of people who complain about a number of things. And then also, one of the big severe things that we typically look at is if a patient is severely constipated and you have excruciating abdominal pain, maybe nausea, vomiting, you might be at risk for having a bowel obstruction. So some people are able to clear their bowel obstruction with laxatives that are hospital grade, etc. And then other people is very severe and they have to have a surgery to correct it. So this is why we're very adamant about treating constipation because you don't want to end up in the hospital and have to have a surgery. You just don't want to do that. There's a lot of common causes I see with constipation. Again, we talk about diet a lot with constipation or the lack of or what you're getting in your diet. A lot of times if patients are just eating fatty foods, you're at the fast food line every day, you're not getting a lot of fruits and vegetables in your diet, or most of them are at least moderately constipated, if not severe. A lack of hydration is really important in constipation, and I feel like people just skip over this. Water plays a big part in our body anyways. Again, it helps us eliminate toxins. It also helps to keep the stool to be able to come down the colon. So if you are dehydrated, and that just is a direct correlation to the stool being dry, being stuck in the colon, it needs some lubrication so that it can come down. Water is what provides that. Another thing is not enough fiber in the diet. I think every day I tell every person that I talk to that you should be having at least a fiber supplement. So if you're not getting the fiber by orally intake in your diet, then you also need to supplement that. You can do that with psyllium husk, that's a natural fiber, or you can do it with fibers that you can get from the pharmacy, so Metamucil or Benefiber. Those are really good fibers, whatever you want. They have a lot of different options these days. I usually tell my patients whatever you're comfortable with. They have fiber pills, they have fiber gummies, they have powders. Whatever you want, you can just get it in your system. Another thing is move your body, get up, move around. If you live a very sedentary lifestyle where you just lay around all day, sit down, whatever the case may be, that can also cause constipation because you're not moving your body to get things moving and down. So I always tell people, even if you have an exercise regimen that is very low on the total, you could just walk. You can get a walking pad. You can march in place if you want to at home if you don't have any of those things, but as long as you're moving your body, that is what's important. The next thing is certain medications. So there are certain medications that may cause you to have constipation, and so that's something that we also look at when we see our patients for constipation or bloating, or if they have both of the two. So what medications are you taking? Did the constipation start when you started taking the medication? All those kinds of things kind of go hand in hand. So we like to make sure that we cover all those bases so we know when these things started and what we're also treating. So what can we do? First of all, again, hydration is key. I don't just mean one bottle of water or 2 cups of water or whatever a day. You need to be having consistent intake throughout the day. I typically tell my patients to look up what their weight is in kilograms, and then you can even ask Google, hey, I weigh this many kilograms. How many ounces of water at minimum should I be getting a day? Typically, I tell my patients that they should be getting at least at minimum about 60 to 80 ounces a day of water, 60 to 80 ounces a day, and that is at minimum. Again, fiber, lots of green vegetables, fruit, chia seeds. Even if you do that in water, that's a good thing. So lots of fiber, even okra. Okra has a lot of fiber in it. I know a lot of people do like okra water these days. It has a lot of fiber in it, but you can just look up high fiber foods and then see what you like, and then you can intake those the way that you want to. And if you can't get that through oral intake, supplement. You can do pills, gummies, whatever you want. Just get it in your system. Of course, again, movement definitely matters. Again, moving your body is something that always helps. Walking, stretching, just even, again, if you have to do some walking in place or whatever the case may be, movement helps to stimulate the gut. If your bowels are just, you are struggling every day, you're having some other symptoms, I would suggest talking to your primary care doctor, maybe getting a referral to a GI, just so that we can go over and assess your symptoms and see if you need other testing. Sometimes patients who have very chronic constipation and don't know why end up getting a colonoscopy or other testing that would help to figure out, is it the pelvic floor for women? Is it the stimulation of the sphincters in the anal area? So there's a lot of things that we get to or go over before we get to those types of tests, but it doesn't hurt, to talk to someone about your symptoms if they are very severe. Another sign that I hear a lot, or I'm hearing a lot more lately, is constant fatigue. This is a sign that surprises a lot of people because I always hear patients to say, oh man, I'm just so tired all the time. Even if I have a good night's rest, I'm just tired. If you're constantly tired, you have low energy, or you're feeling drained, it could be a gut problem. It could be another problem. We don't know. Sometimes it can have everything to do with the gut. Just because your gut is responsible for absorbing nutrients from the things that you put in your body. So iron, B12, or other vitamins that the body might need for energy. We see a lot of patients with anemia, and we find out later that they have a lot of absorption problems because they're not absorbing iron very well. So they'll have iron deficiency anemia. So sometimes if your gut is not absorbing well and not giving you what you need, you can just be deficient of energy and be very tired. We also talk a lot about the the gut-brain axis. So the gut-brain axis, the gut is directly good Lord. It is directly connected to the brain. So I like to talk about the gut-brain axis with patients, depending on how much time that I have, because a lot of people don't really know this. 1, 2, there are things that goes on in the brain. For example, if you're very stressed or you have high anxiety, sometimes it directly affects the gut and might give you that bubbly, how people used to say, oh, I got the bubble guts if I'm scared. Oh, I got the bubble guts if I'm about to get on a roller coaster. That is your mind telling you, oh, I'm scared. Now my stomach is doing something. So they are very connected. So if your energy is off or the gut is not doing what it's supposed to do, it can affect your energy, it can affect your mood, it can also affect your mental clarity. Other signs we notice with this is brain fog, if you're feeling very sluggish after meals, if you're needing caffeine all the time just to function throughout the day, might want to look at some other things. So what can you start doing if you feel chronically fatigued? Vitamins. A lot of people, if you're just doing a multivitamin every day, that will do it. That will help out, especially if your body is not absorbing what it needs to. You can also supplement and do vitamins or supplements. A lot of people do magnesium, which I love as a supplement because it has so many good just salts. It helps with joint health. It helps with gut health. It helps with sleep. It just helps with a lot of things. So I'm a big fan of magnesium. I'm also a big fan of just B12 or B6 or a vitamin B complex altogether. Love that. So a lot of times patients might be deficient in vitamins or something like that, or not even taking them. And so you can supplement your body with these things, but also just look at the quality of your diet. Again, try to get the best foods in your body. Be kind, right, to your body. Get the best produce that you can find. I know groceries are freaking sky high, but if you have local farmers markets like we do in our area where there are farmers and people who grow their own stuff, I would take my money over there and patronize those people in a second, because I know where it's grown, it's not full of hormones or whatever else they put in their bodies that can affect, again, your gut health. So just pay attention to your body, eliminating a lot of processed options. I know fast food is cheaper than going to the grocery stores these days. I just went to the grocery store and I think I got 7 things and spent $80. And it's just like, what is it? Where is the $80 coming from? What is that? But if the fatigue is ongoing and you're just super tired, I definitely, again, would recommend seeing your primary care doctor, speaking to a GI specialist if it has to do with bloating or you think it has to do more about the gut, just so that we can assess. We can always do blood work, see where your levels are. Again, some people are sometimes iron deficient because of absorption issues. And so we find this after further investigation, but you have to talk to someone first, let them know what's going on, and then we can go from there with our investigation and assessment. Skin issues is my favorite thing to talk about when we're talking about gut health and how our skin reacts to certain things and what comes out on the face. I'm going to use myself as an example. For the longest time, and I still am, I'm a hormonal acne girl. As you can see, and my skin is doing so much better. But on this barrier right here, on the chin and jawline, is where I break out the most. Why? Again, hormones. But on top of hormones, you have to watch what you're eating. If you're eating, I know, of course, when we were teenagers, we're eating a lot of sugars and sodas and junk foods and things like that, just putting anything in our body. As I've gotten older, I'm very conscious of what I put into my body, just trying to make sure I'm getting my super greens, making sure I'm staying on top of my fruits and vegetables. But I realized that when I was eating a lot of sugar and when I was eating a lot or drinking a lot of caffeine and stuff like that, my skin would flare up. I also have seborrheic dermatitis, which I think I mentioned in a video before. But I can notice when I'm eating really bad or not eating the best foods, my scalp is all flared up, it's flaky, it's itchy, my face is breaking out, etc. And so I had to really get real with stuff. I'm taking 2 probiotics a day, making sure I'm putting good things in my body, making sure I'm moving my body and working out so that I can get these toxins out. But a lot of people don't understand that along with the skincare that you put in a whole bunch of money in, none of that matters if your gut is not in check, because you'll be doing all that skincare and you'll still be breaking out. And that's because your gut is just doing whatever. So you can't put fancy, expensive products on your face and not be kind to your body. It just really doesn't work that way. A lot of people experience acne, they experience eczema, inflammation, or just overall skin flare-ups. For me, I have back knee. Why do I have back knee? But again, when I started to take better care of myself and my body and figure out what I was putting in it, back knee gone. It's gone. So I need for y'all to understand that the gut has a lot to do with the gut. It's a gut and skin axis. Just like there's a gut and brain axis, there's a gut and skin axis. Again, I recommend just being very cognizant of what you're putting in your body. If you're seeing a lot of flare-ups when you intake a lot of dairy or you eat chicken and you see flare-ups with that, there's a lot of things that people have taken out of their diets, high sugar, saturated fats, all of those kinds of things, and said, oh, look, my skin is getting better. I can't even tell y'all, come on. And I've been an acne girl forever. My face has never been this clear, and I'm almost 36 years old. But I had to get real with stuff, and I want you to get real with that too, because everybody deserves to be looking glowing every day on top of your skincare. But get right with your body. Be kind to your body so it can be kind to you. The last thing that I would like to touch on is gas and discomfort after you're eating or after you eat. I have a lot of patients who come in and say, I have smellier gas than normal. I know that you're supposed to have gas, but I don't think it's supposed to smell like this. Or my breath is smelly. Again, some gas is completely normal. It is the way that we get air and stuff out of the body. Everybody has gas, right? But if you feel uncomfortable every time you eat, if you feel bloated, if you feel gassy, or even in pain, these are not things that you should ignore. A couple of things that we could probably make a connection to might be food intolerance, gut imbalances, IBS, or conditions like SIBO, which is small bacterial overgrowth in in the small intestine. So bacterial overgrowth in the small intestine. That is something that is treated with antibiotics, etc. There's something you also have to be tested for. Again, I'm not diagnosing you. I am not your GI nurse practitioner or your primary care doctor, but these are some things that you can ask about if you are like, man, I've done everything. Maybe I'll get tested for SIBO. Maybe I should get tested for food intolerances or allergies to see if you are intolerant of certain things. So those are some of the things that we recommend. Signs and symptoms that you should look out for. Again, feeling worse after you eat certain foods. I don't really... When people say, oh, I need to unbutton my pants after I unbutton my pants, because sometimes I like to eat real good. So I don't really consider that a symptom. But if you start to maybe avoid certain things that you love to eat because it'll make you feel bad, well, you might want to look into that too. But look for patterns, right? Some things are very normal. Some things are maybe normal, but it's just like, I don't know, I want to check this out. Again, y'all have heard me say in my videos before, it does not hurt to talk to anybody. You can go through it with your primary care doctor, and if your primary care doctor is like, I think this is normal, and you say you do not advocate for yourself, listen, we work for you. If you want to see a specialist, all we got to do is write the referral, and then the specialist can take it from there. So it doesn't hurt to talk to anybody about the symptoms. You know your body best, so you know what's normal and what's not. So I hope this little video will help you guys just to look into if you've been having bloating for a while. Of course, there's other reasons some people have bloating. I know a lot of people, some women are battling PCOS, hormonal changes, if you're perimenopause or just hit menopause. For men, sometimes it could be constipation, it could be what you're eating, not really great gut health. So these are a lot of things that we typically see, or I typically see on a day-to-day basis on what I'm trying to get my patients to identify, see, and connect. It's really good to just be observant of what you're eating, your bowel habits, how your body is reacting to certain foods, and just getting a clearer picture of what could be going on. Again, the gut is very connected to the brain, and so you just want to make sure you have really good gut health. It affects a lot of things. It affects the skin. It affects other organs in your body if it's not functioning well. And so I hope this video will help you guys to identify if you have had prolonged bloating or chronic bloating and you've experienced some constipation or breakouts, etc. Hey, maybe what Brianna is saying or has said, I need to look into. So that's really what I want you guys to take away from this video. So if you enjoyed the bloating gut health topic and you want to talk about more gut health topics, please put in the comments what you want to hear about next. I typically go through on Fridays very short videos, but I think I'm going to start doing longer videos on here so we can really get into the symptoms and signs and solutions of the things that I have maybe prescribed or talk with my patients about, etc., and what could possibly help you guys. Again, I am not your doctor. I am not your nurse practitioner. This is just me speaking from experience, but it doesn't help to talk with your doctors about your signs and symptoms and decide if you need to see a specialist. We'll be doing more of these videos. Also, if you're a fan of lifestyle things, mom things, fashion things, books, fragrances, all of those, and you want to encompass all of that in your gut health too, I'm absolutely your girl. So thank you for watching. Like, share, and subscribe to the channel. Bye.